Subscribe to our YouTube channel and press the bell icon to never miss a video from Radio 1.
This is Erica on 94.3 Radio 1, One World, your station. I'm so thrilled to welcome to the show Dr. Cuterus, aka Dr. Tanaya Narendra. Thanks so much for joining us.
Thank you so much for having me. It's a pleasure.
So I've been, catching your Insta posts. I'm absolutely loving it. Firstly, the name Dr. Cuterus, and also the fact that now you're kind of, simplifying whatever it is, that we're dealing with in terms of sexual health. You're addressing topics. You're kind of, simplifying, whatever questions we've had, and we've had so many questions about sex. So I'm so glad that you're doing this.
Thank you so much. We desperately need to talk more about sex. It's a very routine thing, and sexual health impacts us a lot. So I wish more people talked about it.
Okay, here we are. I'm going to start off with a topic that, is quite popular: boobs and boobology, and the many names that we give our boobs. So a little bit about that and demystifying everything about it.
Breasts are a very sort of important and I think aesthetically pleasing part of our bodies. If people want to go down the line where they're very useful for people, when they have children, they're very important for feeding us. This is where we get our first food from. On top of that, there's also things like, they instill a lot of confidence and, the size and shape, it matters a lot to a lot of people. So breasts are pretty wonderful. We do have a lot of myths about them, particularly about how you should restrain your breasts. Should you restrain your breasts? And they mostly pertain to things like bras. Is wearing a bra good for you? Is wearing a bra bad for you? Will wearing a black bra give you breast cancer? Will
Really?
using underarm deodorant? Yeah, I mean, there's myths like that. It doesn't do anything. There's that fact. But there's a lot of questions about, my mom told me that if I wear a black bra, I'll get breast cancer. Or if I use underarm roll-on deodorant, I'll get breast cancer. And, there's a lot of nonsense myths like that. And they need to be busted because boobs are awesome.
Boobs are absolutely awesome. How does one get breast cancer? Is it the food we eat, the air we breathe? Is it genetic? What is it?
It's all of those things. It's the food we eat, the air we breathe, the products we use, and genetics and things we don't understand yet. Cancer research is still just growing so much right now. We're still learning exactly what does it. But smoking, alcohol, the fun stuff in life, it increases your risk of getting breast cancer. Not having children increases your risk of breast cancer. There's a lot of things. So we're still quite, kind of learning. But the idea is that if you have more, let's get very technical. If you have more estrogen in your body, if you've been exposed to more estrogen in your body, your risk of getting breast cancer increases, which means that if you've had your periods early, if you started your periods early and then you ended your periods late, as in your menopause was late, your risk goes up. There's a bunch of things essentially. And it's so important that we do examine ourselves regularly because there's stats that suggest that 8 out of 10 people who are diagnosed with breast cancer, they diagnose the lumps themselves on their self-examination. Now, this is one of the studies, and I'm not saying this is the final number, but it's a massive number. And it's so important that we do just, fondle ourselves every month and figure out if everything's up.
That's it.
If anything's wrong.
Yep, absolutely. Let's move on to, sex, actually, just the act of sex. There's a pornification of sex. I think you mentioned it in one of your posts. Everything looks nice and perky and bright and perfectly well oiled in porn, but that is not the case in real life. So can you sort of demystify some myths around real sex with real people?
Porn doesn't last. Sex in real life doesn't last for 2 hours like they show it in porn. Most of the performers are having, enhancement drugs.
Yes.
Nobody's penis looks like that. There's a lot of surgery that goes into it. Nobody's vulva or their breasts look like that. There's a lot of surgery, VFX, lighting, pre-production, post-production, everything that goes into it. So it should be treated as entertainment. It should not be treated as the reality.
Oh, there you go. Sex education in our country. I mean, we're still so way behind. I must say, though, I mean, perceptions have changed a lot. I'm dealing with a 17-year-old, and I know that when I chat with him and his friends, they're far more open than I was growing up. I, had. I came from a convent school, so my sex education was like, via nuns, which was basically nothing really. And today, of course, you've got
Yes.
Google. You can Google this, you can Google that. So, talk to us about sex education, the importance of having sex education in schools, and how early should we start?
I'll give a very good example of why I think sex education is essential. So both my parents are fertility specialists, and they had a patient who had 7 years. I mean, the couple had come with 7 years of infertility, and they ran their tests, they did everything. Everything seemed perfectly normal. There was no reason why this couple should have been having problems conceiving. So my dad took the male partner of the couple into the room, and he's like, "Dude, what's up? What are you doing?" And it turns out, for the past 7 years, he'd been sticking it in the belly button
No,
because
it was what
बच्चा
he
पेट
was
में आता
not
है,
not doing. It was what he
बच्चा
was
पेट
not
में
doing.
आता है.
This cannot be true. Is this true?
I wish I was making this up.
Are you serious, man? I mean,
And you speak to fertility specialists, a lot of people will tell you various iterations of this exact same story, that they were doing it wrong. They just don't know how to do it. And I'm not saying, with our massive fertility boom that we have in the country, we need more children. But, if people if they have a valid desire to have children, they should have the means to, they should have the education to go about it. And people just don't know. So many people don't know. So many people, like I've had 50-year-old women coming up to me and saying that I didn't know I had a separate hole from which I could pee. I thought the vagina and the pee hole were the same thing.
oh my God.
It's very commonplace.
So, the fact that when I look at your posts, I mean, you've got the vagina, you've got the uterus and all of that stuff, and you actually show it to your followers in a very matter of fact, in a very medical kind of way. I think we need that in our schools today. We need that. We need that to happen. With everybody, with the boys, with the girls. We need to actually show them. With that, obviously, and I'm sure it can go either way. But obviously, we have within certain constructs. You explain the whole process.
I think it's so important that, because the sort of messages I get from younger people who, have heard in their school and things like that, is that, if you have sex on this day, you won't get pregnant. And if you have sex in this position and then you jump 15 times, you won't get pregnant. See, the thing is, people are going to have sex, whether you like it or not. Let's admit that we've had the best abstinence only programs across the world, but young people have sex. We need to make peace with that fact, and we need to give them the means to make sure that the choices they're making are safe, at least, and they're not endangering their lives in pursuit of this, I don't know, whatever happens. We go a little bit wonky when we're younger, and those hormones are raging through us. So it's very important that non-judgmental and up to their level, as in what they need to know at that age, the basic fundamentals about their body, it's given to them at the right time. I wish people
Absolutely.
told me when I was younger.
Me too. Now, speaking of the current generation, the right swipe generation, do you see sexual promiscuity as negative?
Again, promiscuity is a very loaded word. I don't particularly like using it because it attaches a lot of judgment to a personal choice. We are in an era where casual sex is very commonplace. And if that's the case, people should know more about how to protect themselves while making their own life choices. They should know how to protect themselves from STIs, from unwanted pregnancies, and from unsafe situations. And if they want to have casual sex, they can go do whatever they like. This is their body, their own choice.
Okay. Sex is messy, sex is fun. You've said that before. Some hacks for first timers.
Consent, condoms, and communication are the 3 C's of Dr. Cuterus. And on top of that, lubrication is very important. A lot of people who have sex for the first time, I think most women, when they have sex for the first time, go in with this assumption that, oh, it's going to hurt because all of my friends have told me it's going to hurt, it hurt them. And that's the thing, sex shouldn't hurt, no matter if you have it for the first time or the 15th time or the 1000th time. If it's hurting, that means something is going wrong. Stop, use more lubricant, focus on more foreplay. You need to warm the engine before you drive the car, So people need to get into the right headspace for it. That's it. That's honestly it. Take your time.
This is very important. How does sexual health impact our body and impact our mental health, importantly?
The most common example I always give is a little extreme one, which is HIV. That, sexual HIV comes from, a lot of times, not always, but HIV, you can get HIV from having unsafe sex. And that can lead to complications like AIDS. And, you're on lifelong medication. And, we've made vast advances in medicine this way that people with HIV have a lot more convenient lives. And, they're a lot less complicated now. But having said that, why would you want to go through that? Why would you want to unnecessarily add that burden of getting an infection into you when you can just stay safer? It's like saying, how is your mental health important to your body? It's so important. It's an integral part of your body. They're not separate from your body, and it impacts your health in every which way. Syphilis can cause, untreated syphilis can cause complications in your heart.
How can we get back to the land of Kama Sutra and that kind of culture where we're free and liberated and, sexually positive?
I think a lot more education is integral, and also a lot more of getting out of our colonial hangover. A lot of our restrictions and inhibitions around the idea of sex and sex positivity come from post-colonization or from the colonization era, because our culture is vastly different from the Western culture, and it's time to celebrate those differences instead of feeling bad about those differences. And just, if we can learn from each other and if they can learn from us without exoticizing or fetishizing us, we can just have a healthier, happier world. So get out of the colonial hangover is all I'll say.
Well, that's a fabulous note for us to wrap up this chat. Thank you so much for joining us. It was such fun, Dr. Cuterus, and thank you for what you're doing.
Thank you so much for having me. I had a splendid time talking to you.